Welcome to the Born for Greatness podcast. Today, I have my friend and CEO of Excel Health Plans, Michael Patton. Thank you, Mike, for joining me.
Thanks, Becca. Really appreciate being on today.
Yeah, so you are working on some very exciting things disrupting the healthcare insurance world. So tell us a little bit about that.
Well, it's definitely been an unexpected journey. I think, like a lot of things in life, it came at me in a way that I never really anticipated. I actually, my goal as a kid was to be the head coach of the Denver Broncos and be a professional football coach. So I pursued that out of high school. I coached Division I football at Colorado State University in Fort Collins, Colorado. I worked there between 2006 and 2010. And then I was the defensive backs coach at a little engineering school called Colorado School of Mines in 2011. And football coaching is for those of you who don't know, an extremely volatile injury or industry. And in terms of losing and keeping your job. So I was obviously left coaching at Colorado School of Mines, and I was in between coaching gigs. My mom is a primary care physician of 35 years now, and wound up, they needed some help working at her office in South Denver. So I was coaching high school football and did all sorts of odd jobs working at her office, medical billing, worked the front desk, occasionally worked as an MA, helped with referrals, that type of thing. And it was really while working at that office that I understood how broken the American healthcare system was. So because I did medical billing, I would help people with their EOBs. And if you've never seen an EOB is just something that you get when you have a claim processed on your health insurance card. It's a little statement you get back from your health insurance plan that looks kind of like an invoice. And it says, hey, your health insurance plan paid X. You likely owe Y. And then you'll get a separate bill from the doctor's office saying, hey, you owe X. So a lot of people would come and ask me for help saying, okay. And then they frequently are kind of confusing. So people, after doing a lot of medical billing there, would frequently come and ask for help. Hey, I got all these EOBs. I've got these invoices. Which ones do I pay? And someone had a pacemaker put in. And that pacemaker, and the guy came in and, similar situation. Hey, I mean, he had a lot of EOBs. I mean, big stack of bills. So he had something serious happen. Right. And I just started looking through the EOBs, and he was just, curious of what his out-of-pocket exposure was. And I mean, when I had to go grab like a calculator to go see like how big all these claims were and what they total out to, and it total out to like $1 million in billed charges and about 600,000 claims. And then I asked the guy, hey, what on earth was going on here? And I was looking up the codes, and he had just had a pacemaker put in. It wasn't anything extraordinary. What happened was pacemaker started falling off of his heart. They had to go back in and then reattach it. So because of a medical error for the facility, they had to go in and do a second procedure. And then in the second reattachment procedure, the guy caught sepsis and was inpatient in the ICU for a number of years, which is what made the entire thing so expensive. And that just didn't make any sense to me at the time. And so while my mom was in residency back when we were kids, we had au pairs from Europe who actually both happened to work, interestingly enough, in the healthcare system. And I called them, right after this happened, and asked them, hey, what would a pacemaker cost? They live in Sweden and Switzerland. One is a NP who's an anesthesiologist. The other one is a nurse, runs nurses in Bern, Switzerland. And I asked my friend in Sweden what it would cost. This is about 10 years ago. This is 2012. And it was about 15 grand in Sweden and then it was 18 grand in Switzerland. And I asked them, hey, what if this scenario occurred? What if this error
Hmm.
occurred? What would American pay cash if this happened? And both of them were like, we would eat that charge, because if we screwed it up, then we wouldn't charge you for it. And I was like, okay.
Right. Hmm.
something
Yep.
something is hooey here, and something needs to be done about it. And that really just was kind of the spark that triggered everything for me, and really incented me to be like, hey, what is wrong with the healthcare system, and go from there. So what happened after that was, I mean, I still really wanted to coach football. I had a, deeply ingrained passion for, coaching professional football. And it took me quite a while between, coming to grips with, was this the path that, God wanted for me versus what did I want? I knew that I wanted to coach football. I really struggled with that. So giving it up was tough, but, through definitely some counseling and some understanding that I had always felt like I was in the wrong place doing the wrong thing, coaching, like it was all for me,
Hmm.
and tried to justify in my mind that I could do something positive out of it. And that was maybe the rationale for it. But I think I knew deep down that it was all for me.
Hmm.
So I could see myself being shifted out of that. It took me probably I think it was till 2014 when I really came to grips with giving it up. And so in the interim, I started to kind of look into healthcare as opportunities weren't, manifesting in the football coaching realm. I nearly got a couple jobs coaching in the NFL and coaching at Northwestern. And if I just would have had like one person make the call about one thing, I probably would have had them. And I definitely consider myself blessed to be out of coaching. It's a rough business, and no part of
I'm
me wishes
sure.
I were still doing it. But yeah, so I actually looked into working for maybe like a hospital system or a couple of
Hmm.
the health insurance companies. This is kind of 2013-ish range and 14, and realized after speaking to the individuals that it was very clouded to actually understand how money changes hands between healthcare and health insurance. And the reason that health insurance is so important in healthcare is because it's really the filter by which all of the money changes hands in healthcare. So everybody pays their premiums, and it's about a $4.5 trillion industry right now as we sit in
Wow.
2020. So roughly a fifth of the economy, somewhere around 20% of the entire economy. And probably the most alarming part of that is that in 2000 it was only 11% of the economy. So it's
Wow.
eaten an extra 9% of total GDP over the course of the last 20 years, to put the inflation in perspective. And the inflation really is only with college tuition in terms of the highest rate of increase. So the commercial payment system that I work on now is the most expensive portion of that. Most of the rest is Medicaid and Medicare. So, of that 4.5 trillion, I mean, I would roughly estimate maybe a trillion for Medicare, probably a little under a trillion, maybe 700 million or 700 billion probably for Medicaid, and probably all the rest is commercial. So commercial
Wow.
pays for a lion's share of the total cost, even
Hmm.
if, there's a lot of older people getting a lot of care there. They tend to pay a lot less per procedure on Medicare than does the commercial side.
Gotcha.
So yeah, the government capitates how much Medicare is willing to pay for things. And that's, interestingly enough, one of the few benchmarks we have in our industry to understand what things actually cost.
Hmm.
So what led me into my current space was I became a benefits consultant. And then the path that I had to becoming a benefits consultant was after kind of learning that it would take me a very long time to understand the movement of money on either the hospital or the health insurance carrier side, I didn't really feel like I cared to wait as long as they were telling me it was likely going to take, somewhere in the realm of a decade to actually see that. I talked to some friends at a networking event and they said, hey, the benefits consulting firms have analytics departments. You should go talk to them and see if you can work in one of those departments. And I got a couple meetings with a couple of them and tried to do exactly that. Now, of course, I'm like 24 at the time. As
Right.
they would describe it, I have no work experience because college football coaching doesn't count, and they can
We know.
hire finance people with 5 years experience to do those gigs. And I'm a marketing major with no experience. But actually both of them said, hey, you got a good personality. You should get into the sales side of consulting. And I was like, cool. Will you hire me? And in the brokerage space, they don't, most of the big consulting firms will not hire anyone who's a rookie. I think they will now because hiring's so brutal. But yeah, back then, of course, they don't hire anyone who's a newbie. They want you to go work for a small firm, prove that you can, make it on your own, and then they go poach you. That's typically their business model. So one of the two of them actually was nice enough to set me up with some interviews, but through some of my connections at college football coaching, interestingly enough, I was able to secure a job as a benefits consultant for a firm in Colorado. And I worked for them between 2014 and 2017, and really just kind of got my feet wet selling a lot of health insurance plans. And what we do from like a layman's side of things, you can buy health insurance plans. You're typically buying them, and benefits consultants are kind of like, in general, they mostly are just, they sell products. So they sell the health
Mhm.
insurance product from the four major carriers. In our space, we typically refer to them as the Bucas, Blues, United, Cigna, and Aetna, because they all operate in a relatively similar fashion.
Okay.
So, in Colorado, I was selling a lot of Cigna. Cigna has kind of the most influential carrier in the Colorado market. That doesn't tend to be true nationally. It's mostly Blue Cross that tends to be the biggest one. But um, that's kind of how I started out. And well, I first took on my first case so what you can do is self-fund health insurance plans. And what that means for like a layman or somebody who's not in our industry is you're basically putting all the pieces back together. My best way I can describe it is it's like, for real estate people out there, it's like a custom home versus a track home. And in health insurance in general, you're pretty much always buying track homes. But if you work with a independent claims payer called a third party administrator, and you can go build a custom home, build a custom health insurance plan, and have it insured through secondary insurance policies called stop loss insurance policies, where a lot of the companies you probably heard of, like Gerber Life or Travelers or Zurich, the big property and life insurance companies, will actually be the ones backing your program rather than, the typical health insurance companies. And there's a
Right.
decent nationwide market for that. So through doing that, I met a friend in the space, and he showed me how to do this on a company. And this company was spending a lot of money on specialty medications. People on this podcast have probably heard of a drug called Humira. Humira is the number one most prescribed specialty medication in the world. And I think right now, some of the claims we've seen, it's running at, between $90,000 and $110,000 a year for the average 180
Wow.
pound. So it's extraordinarily expensive. And there's a reason for that. And that is because, like, with the insurance companies conglomerating the middlemen in the pharmacy space, known as the pharmacy benefit managers, CVS Caremark actually makes much more money from being the pharmacy benefit manager, even before they acquired Aetna, than they ever made off their retail side. That's where United Healthcare and Optum make a lion's share of their profits. And then Cigna has acquired Express Scripts for more money than their entire market cap. They were able to acquire
Wow.
Express. Yeah. Can I get a loan for more money than the company's worth? Uh, So because of that, there's just a huge incentive for companies to put a lot of these expensive drugs on the plans, because there's a lot of ways to make money off of that.
Mhm.
And what I found is just by carving those drugs out of the plan and working with some vendors that can do things like IPP, or using manufacturers assistance programs, where we're signing the member up for a manufacturer's free program, which is mandated, and just carving out the benefits manager, you can get those drugs for 20 to 30 cents on the dollar and help really save health plans a lot of capital. So we did that to a group, construction company in Northern Colorado, and we're able to save them like $500,000 a year. They were getting an
Wow.
80% increase because of those drugs. And we were able to cut that increase down to a 10% increase instead of 80, just by employing one of these strategies. And I was like, wow, that was easy. I need to do this on all of my plans. And so I set out to start doing that. And what happened is I started working that on a couple of my current, in-force customers, because they were spending a lot of money on specialty medications. As I started down the process to go move them over to this same strategy, they were with one of the carriers that we have in Colorado, and I got walked into my boss's office as I was starting to move this. And what they told me was, I would commit to not moving either of these two cases away from the health insurance company that we were with, because if I moved those two groups, what I found out later was, we were making north of 25% of our entire benefits revenue at the firm I worked for, just in an override bonus that we make for a minimum life count retention, or a percentage of our groups with this carrier. And we would have been stripped of that entire bonus had I moved those two groups. So in spite of the fact that, in our handbook, it always said to do what's in the best interest of the client, I was pretty bluntly told, you'll either keep these groups where they are, or you might as well just walk out the door right now. And so obviously I was not ready. I wasn't prepared for that, because I wasn't aware of these bonus programs at the time, and I didn't have a plan, so I didn't take the walk out the door option. But in my mind, that ensured that I was going to walk out the door at some point of that firm anyway. And so I went back and met with more of the larger consulting firms in my region. And at that point, I was very pointed to ask, how much control and influence over where I place my business going forward would I have? And they were pretty blunt about I wouldn't have much as a young guy. They were going to tell me what I should do rather than me
Right.
having sway. So I wasn't very interested in that, and decided the heck with it and started my own shop in the fall of 2017. And what we did is we wrote quite a bit of reference-based pricing. So for everybody out there, reference-based pricing is like the out-of-network side of a health insurance plan. And imagine the entire plan is out-of-network benefits. And the primary purpose of it is you can effectively just pay a lot less for health insurance. So like on a large claim like that pacemaker that I told you about,
Right.
the way that it would work is, rather than paying the negotiated rate that that was with Aetna, and Aetna has a negotiated rate that was at University of Colorado Health. They'll say, we have a negotiated rate of 45% off discount off of billed charges. And the way a reference-based pricing plan would say is, we will pay 1.5 times whatever Medicare is willing to pay for the same occurrence, and that's all we'll pay. And then they negotiate with the facility. Kind of the dirty trick on it that is lousy, though, is that they use the leverage of the member, of hoping that the facility doesn't want to balance bill the member as the primary leverage point. So not great from the member side of things, but obviously any leverage you can gain on healthcare is certainly can be a cost saver. So if you're paying 1.5 times Medicare, you can save somewhere in the wheelhouse of at least 30 plus percent on top of what the PPO, with those preferred provider networks that the carriers have, you're looking at least 30% savings over that. So some companies are certainly very interested in that. And a lot of the groups that I was writing, I was kind of working in niches where companies were very cash restricted. So it was an advantageous sales pitch to cut their benefits costs by that amount. So we did a lot of business in the next 12 months doing that concept. But then what happened after that was the two largest hospital systems in Colorado really said, we won't take anyone who has this reference-based pricing at all. And they would turn people away just the second that they showed up to the facilities. So, because obviously from the hospital's perspective, they're not very interested in only being reimbursed, like in Colorado, to put this in perspective, the PPO networks probably reimburse the hospitals between 2.6 and 2.8 times what Medicare gets. So obviously, if we're sitting there only paying them 1.5 times what Medicare gets, they're getting a lot worse deal than they typically are through the insurance carriers. So
Right.
they're not super interested in taking that deal. And it's happened in a few markets nationally, but the two largest systems in Colorado stopped taking it. So that was very problematic for my clients.
Yeah.
Kind of where we're at with Excel Health Plans is it was one of those situations where, it was just a situation of necessity that bred some innovation on the plan. And I don't think our plans are, sometimes it doesn't feel like they're as innovative as it seems like they are in the market at current, because all we did was we took a concept that the Medicare Advantage plans employ from working at my mom's office, where they'll say, okay, you can't go see a specialist without approval back from the plan. And that's pretty standard operating procedure for a Medicare plan or an HMO style plan. So we took the same tactic in our health plans, and there's things called bundled surgical procedures for outpatient surgeries and imaging. So
Mm-hmm.
you can get, an ACL reconstruction in South Denver for $8,000 or $9,000 from a surgery center called Dry Creek Surgery Center in South side of Denver. And you can go across the street to one of the specialty hospitals that are some kind of famous orthopedic surgeons, and your PPO
Right.
plan will pay between 39 and 51 grand for an outpatient ACL reconstruction. So there's a pretty drastic differential. And all we started doing was offering members, hey, if you'll go to the lower cost one, we'll reward you with not having to pay anything for your surgery. So no deductible, co-insurance, whatever. Your average member's out-of-pocket limit right now is probably between $6,000 and $7,000. So we're offering to save a member all $7,000 of those dollars if they're willing to save the plan, $10,000, $20,000, $30,000. So, and same type of concept for imaging. You can go get an MRI done for $5,000 to $10,000, and on our plans through these bundled agreements, you can pretty much get every type of MRI and imaging done for less than $500. So once
Wow.
again, we offer up to a company, go get this for free. And then that's kind of the primary just of how Excel Health Plans works now. But we tested that, and after about a year of testing that versus still had some leftover reference-based plans, what we found was if reference-based plans cost 30% less than the standard market, our plans were only about 7 or 8% more expensive than reference-based plans. So, 22% less than the market with really none of the headache.
Right.
So that was where the idea, jumped in my head, where it was like, okay, well, if this runs this cleanly, then there's no purpose in selling reference-based plans, because the difference in price is not worth I would never advise a client to go that route unless they were truly desperate and absolutely needed that 8% savings that badly. I would say, should probably not go that route, because your employees
Right.
will probably complain at an extent that it's not really worth it for you.
Right.
And I met my business partner Dylan in 2018. We were just friends for a couple of years, and he got a job with one of our vendors who did, especially the pharmacy side of our cost savings that are embedded in the plans now. And he really helped encourage me to look at how could we package this together, and then resell it out to the market, because it's a difficult thing to construct. Putting all the pieces together and getting it to flow correctly is very difficult, and I had a lot of reps at doing that.
Right.
And so yeah, we just kind of started entertaining doing that. I left working with my first business partner in the fall of 2020, and then we really just started working on this concept. We basically beta tested it on a half a dozen groups in 2021, which is really what we were doing. And we launched XL Health Plans in full on 1/1 of 2022. And, yeah, there's definitely been an explosion of interest and scale. And we've grown tremendously, leaps and bounds, and are up to having, almost 10 staff now, just in 12 months. So definitely been very blessed for the business to scale at that pace and that level. And that's kind of how this whole thing came together. And, obviously our goal is to continue to spread health plans like this across the country as fast as we can, and then deliver all of those millions of dollars in savings that we have for employers so far this year, and have them hopefully split it between themselves and their employees, which for the most part has been true on most of the companies that we save money for. Probably between 60 and 80% of the savings is just going back directly to the employees on the plan.
That's awesome. That is so great. So I know, just because I know you have given up higher paying jobs of selling other plans to dive into this and make this your mission and passion. Um, Tell me, what was it? What is that one thing that's driving you to do this, and kind of give up the easier way, which and the better paying way in the beginning? Why? Just why?
So yeah, I would say that the mission first, but faith is obviously like the driving force in my life. So I know that I knew, like, from the start, like when that $600,000 pacemaker came in, like I was on a mission to, somebody had to do something about this healthcare inflation. And once I realized, putting that first case on the self-funded basis, that you could make such a profound impact on a company by just employing some of these strategies, I knew that that was the right thing to do. That was the way that needed to be pursued. And it was very clear to me, after I knew I was going to leave my first firm, and I interviewed with the other firms, that they were going to basically push me in a similar manner that my first firm did. And so it was just going to be a similar gig with a lot larger paycheck. And you're exactly right. I probably could have been making in the north of six-figure range to start out. And if I had continued to build a book, which I, have confidence that I know how to do, I could have been making a pretty handsome amount of money for between 2017 and right now. And you're certainly correct that I surrendered that opportunity to pursue this one. But for me, it was really just a moral thing more than anything, is that once I knew that this is what was right for my clients, I didn't even let myself get to the meetings with any of those firms that I interviewed with to actually even receive an offer, because I didn't want to have to turn the money down. I just thought it would be easier to just
Yeah.
decline to even have the conversation, because I knew that I couldn't look myself in the mirror, especially knowing what I already knew then, and especially know now, like I would have been peddling the problem to my clients and had to make my living doing what I knew wasn't right. And yeah, I don't think I could have gone to sleep at night if I was doing that. So at least at the time, it didn't seem like that hard of a decision. But you're certainly correct. I probably passed on a fair amount of wealth I could have generated for myself in the short run.
Well, I think obviously what you're doing is going to have such a profound impact and you will be rewarded in the long run. What would you say? Do you have a piece of advice for somebody who's coming up against a similar situation and realizes that they could make a difference and contribute in a positive way, but is a little afraid to take that leap?
Yeah, I would say, I mean, making the leap is never easy. And I was blessed at the time to both be single and, have a mortgage of like, I don't know, $800 a month or something ridiculously low like that. So that barrier is certainly lower for somebody who was in my
Right.
position at the time, being both young and having really low overhead and expenses makes it a lot easier to be an entrepreneur. But I would say that, if it was meant to happen, it will, like, you'll be able to find a way in a creative fashion to be able to get what you need. And I've always found that your needs are always met, especially if you're doing what's right. You'll get what you need if you're, in the right place at the right time. So it's definitely been a journey for me in starting, especially the second company, Excel Health Plans. The overhead's been higher significantly on this one. And, we definitely had times where I didn't know how much capital, like we needed capital. And obviously it's always manifested itself pretty quickly. And we've never struggled to make ends meet. That doesn't mean we haven't come right up against it, but it always seems to just happen for us. So I would say, kind of faith is like the biggest thing in being an entrepreneur. Like it's going to be tough at times, and you can't go in, halfway. You have to go all in. You'll never, like, that would probably be my biggest advice, is don't try to like, oh, I'm going to go get some tertiary revenue. I'm going to work a side job and I'm going to slowly ease my way in. Well, if you're going to do that, go work a job full time, try to stash as much cash as you can, then make a jump to go be an entrepreneur. Because what you're going to find as an entrepreneur, everyone's like, well, I want to be an entrepreneur so I can get freedom. But you're always going to work more hours when you're an entrepreneur than
So
less.
true.
You're just not going to have time to do the other side of things. So that would be my biggest advice, is definitely you're not going to have enough time. So stash the cash first and then make the jump would be my advice.
Awesome. That's great. Well, thank you so much for joining me. If people want to find out for their own companies more about Excel Health Plans, how do they get in touch with you?
Yeah, they can reach out to me. My email address is michael@excelhealthplans.com, or you can find us online, excelhealthplans.com.
Awesome. Well, thank you again, and thank you everyone for joining us.